Hello and welcome to this channel. My name is Dr. Aurora Maranga, consultant gynecologist and cancer specialist at 𝗕𝗃𝗄𝗄 Hospital in Nairobi. Today I'd like us to talk about an interesting topic. Does birth control cause cancer? And if it does, what type of cancers? Today we want to talk about facts. We separate fear from actual facts. Now, which contraceptives are we talking about? We're talking about the pills, the contraceptive pills, the normal pills like microgynon, 𝗪𝗔𝗵, those which contain progesterone and estrogens, and then in the market in various brand names. These are usually taken every day. Then we have the implants, which are put on the arms. Usually they contain progesterone only. We do have also others, the coils. Some of them, like Mirena, for example, which has hormones, and others like 𝗘𝘃𝗲𝗿, which don't have hormones. These are coils. There are injections like 𝗕𝗵𝘁𝗶𝗿, which is usually given once every 3 months. There are the injections which are given once every month or every 2 months. Then there are also the patches. Those are usually patched. It's a patch. It contains hormones, estrogen and progesterone most of the time. And it's put on the skin and it's changed every so often, every week. And the medication goes through the skin into the body to the bloodstream. And that's how it does birth control. Now, the cancers which we are going to discuss is how all these contraceptives relate to, say, breast cancer. How do they relate to cervical cancer? How do they relate to ovarian cancer and uterine cancer, or even colon cancer? Now, the relationship between contraceptives, that is birth control methods, and cancer is not a straight line of relationship. It's actually a complex relationship. And some of the studies have shown some risk of some of these contraceptives to particular cancers. And I'll start off with the pill. The daily pill has been associated as a risk factor for breast cancer and also a risk factor for cervical cancer. But at the same time, it has also been noted that it reduces the risk for ovarian cancer. It reduces the risk for uterine cancer. It also reduces the risk for colon cancer. So these are from studies which have been done and shown that some people are using, those women who are using the pill, they tend to have higher risks for certain types of cancers, but they also have lower risks for other types of cancers. That's why I said it's a complex type of relationship. And May hasten to say this, that even as we discuss this, it has to be individualized. It's not always like the risk is uniform across board. That's why you need to see your gynecologist, you see your doctor to discuss your individual circumstances, your individual risk factors, to determine which is the best contraceptive for you. Some of the issues which would usually be looked at are the risk factors for for cancer. For example, if there's a strong family history for those particular cancers, depending also if you have personal individual risk factors like obesity, if one is diabetic, if one has had blood clots before, what we call deep venous thrombosis or DVT, if one is hypertensive, and such like risk factors, so that your doctor can actually assess and see whether you are fit for this method or for the other method. Going back to the relationship between contraceptives, that is birth control methods, and cancers, others like hormone-containing coils like Mirena have been found to have to cause or to have a reduced risk for uterine cancers. The others like condoms have been extrapolated probably to prevent human papillomavirus and therefore to reduce the risk for acquisition of human papillomavirus and therefore development of cervical cancer. But by and large, most of these contraceptives, they are safe for use, and their benefits in terms of birth control for most women far outweighs the risk of developing cancer to them. And therefore, one wouldn't say and condemn a particular method wholesome, that it does cause cancer and therefore should not be in the market. A lot of studies have been done, and of course, others continue being done to ensure that there is safety of these methods to women worldwide. Now, this has been Dr. Aurora Maranga, consultant gynecologist and cancer specialist at Janis Hospital in Nairobi. Remember to subscribe and share. Thank you.